Our planet's health is our health. We are all interconnected. The air we breathe, the water we drink, and the soil we harvest. The climate crisis is a health crisis, and no one is safe. The World Health Organization calls climate change the single biggest health threat facing humanity. Low and middle income countries are especially at risk of climate change induced health risks due to weak infrastructure and poor access to high quality primary health care. Despite increased recognition of a need for action, there is limited evidence on cost effective, sustainable, and community integrated interventions, risks that are further magnified due to inadequate research capacity to address these challenges. The NIHR Global Health Research Center for Non-Communicable Diseases and Environmental Change, a partnership between Imperial College London and the George Institute for Global Health, aims to tackle the dual challenges of the rapidly growing burden of non-communicable diseases and the threat of environmental change in Bangladesh, Indonesia, and India. In collaboration with ICTDRB in Bangladesh, the University of Brawijaya in Indonesia, and Sri Ramachandra Institute for Higher Education and Research in India. Distinct priorities were identified for each country. Water salinity in Bangladesh to mitigate its harmful health effects on vulnerable populations. Plastic burning and the exposure to the resultant air pollutants in Indonesia and its associated negative health outcomes. Co-designed interventions in India to address the deteriorating dietary diversity and malnutrition in the nation, along with heat adaptation tools to prevent and manage heat stress and its related illnesses in high-risk communities. Our research priorities have, since we embarked on this journey, been co-developed with local communities and primary healthcare professionals who have actively collaborated with our research teams to design, implement, and evaluate interventions. Anchored in our guiding principles of respect, trust, and cultural sensitivity. Through more than 300 formal and informal community engagement activities that garnered participation of over 6,000 community members and stakeholders across our focus countries, we've laid a firm foundation of sustainable and equitable research. Community feedback and voices, especially those of the vulnerable and often marginalized, have been the driving force of our research. With our established partnerships with nearly 25 grassroots NGOs and local government departments to support the implementation of research interventions, we aim to embed and drive the positive impact of the interventions beyond the project's life cycle. Participatory approaches like Photo Voice enabled communities in rural Indonesia to visually document local waste issues and solutions, encouraging community-led initiatives such as waste banks and awareness camps on waste management. Our community-managed nutrition gardens are now a vital source of fresh local produce for 10 school feeding programs and 8 Anganwadi initiatives in Sarguja, Chhattisgarh. By combining co-designing, capacity strengthening, and digital innovation, Smart Health, a mobile-enabled digital health platform, has been designed to empower frontline health workers and doctors to deliver high-quality care to underserved communities in India and Indonesia. Encompassing digital tools that provide heat health risk assessment and multimorbidity support for primary healthcare workers to facilitate effective responses to risks. The Smart Health application is now live on Google Play Stores in both India and Indonesia to help communities receive timely risk alerts in both English and regional languages. Step by step, milestone by milestone, we are moving closer to transforming research into action and challenges into opportunities. Every conversation, collaboration, and meal shared has helped us foster meaningful connections.
मैं यही कहना चाहूँगी कि महिलाओं के बीच में जाके जो छोटे बच्चे से लेकर बड़े बुजुर्ग तक जो जिसके लिए स्वास्थ्य के लिए जब काम कर रहे हैं, तो जब हमारे काम से उनका स्वास्थ्य ठीक हो रहा है, तो यही कहना चाहूँगी कि अच्छा लगता है इसके बीच में रह के काम करने में।
Committed to strengthening research capacity, our tailored initiatives of mentorship, peer learning, and more are building resilient communities of practice. World-class global experts are mentors to young, early, and mid-career researchers fostered and supported under the New Research Leader program as they transition into their roles of thought leaders and global health advocates of the future. Training courses of more than 140 hours as both pre-recorded and interactive sessions by global subject matter experts have supported over 300 participants in their practical skill building in research management, communications, and more. As our efforts flourished, our community thrived and grew. Together, we established valuable partnerships, extended our influence, and amplified our positive impact through advocacy and policy dialogues, bringing the communities we aim to serve to the fore.
मैं चाहूँगी कि जो सबसे जरूरी है वो है पोषक तत्व, जो हर व्यक्ति, बच्चे, गर्भवती महिला और जितने भी व्यक्ति हैं सब तक पहुँचे, ताकि वो अच्छा चीज़ों को खाएं तो स्वच्छ रहेंगे, स्वस्थ रहेंगे, तो वो किसी भी कार्य के लिए प्रेरित होंगे, आगे आएंगे.
Our journey ahead will focus on fully implementing our co-designed interventions, rigorously evaluating their effectiveness, deepening partnerships across countries and communities, while advancing climate resilience for long-term sustainable global impact. Together, we will build a future we can be proud of.